Welcome to rePROs Fight Back, a podcast on all things related to sexual and reproductive health rights and justice. Hi, rePROs. How's everybody doing? I'm your host, Jenny Wetter, and my pronouns are she, her. So y'all, I'm back. I had a great leadership training that I went to and also had a ton of fun at Disney for my add-on trip. You know, I have to say the only downside, it was so much fun, was that the weather was just brutal. It was so hot and so humid. Like the high each day was 90 and in the mornings it was like 80% humidity. Like it was just disgusting. It was like walk outside, immediately start sweating. I joked around that I became more Powerade than person as the days went on of like having to drink so much Powerade to try and stay hydrated. It was wild, but it was so much fun. My friend and I went to Mickey's Not So Scary Halloween party and dressed up as villains. She went as Cruella de Vil and I went as Ursula. My mom helped me put this really fun skirt together with tulle, and it was really cute. I will see if I have a picture that I can have Elena share so y'all can see. It was a lot of fun. Yeah, but it was just so great to just like take a step away from everything. Like it was like a whole week where, I mean, I checked emails just to make sure like there was nothing urgent that needed responding to, but like I wasn't on social other than to like post pictures and just like to take this giant step back. It was really nice to just kind of get away from all of the things. It was really needed. I mean, the downside was I came back like at midnight on Monday night, so like had to like jump straight into work and was like exhausted from the heat. Like, man, the heat just like took it out of me. The last day I had to leave the park early because I couldn't do it anymore. My body was just like, no, we're done. 4 days of walking around in this humidity and heat, and we're done. So go back to the hotel, sit in the air conditioning, and then you can go home. So it was rough. My feet are still tired. I'm tired. But it was a lot of fun, and it was just the trip I needed to just get away from all the things. But yeah, it was a good trip. I'm so glad that my friend came with, and we had so much fun. And took so many silly pictures, y'all. So many silly pictures. Honestly, if you're going to go and do Disney, if you don't like do all the silly pictures, like what's the point? I don't know. It was just so much fun. Let's see. My cats have been like super clingy since I got back. I get it. They missed me, but like, oh, so much attention is being demanded at all times. Like crying outside the bathroom door if I'm taking a shower, attention demanding. Like, oh, it's been rough. Lots of snuggles demanded, but they're cute. I don't mind snuggling, but just like maybe not while I'm working. Yeah, maybe not. With that, I think let's turn to this week's interview. Last month marked the 40th anniversary of the Global Gag Rule, so it felt like a good time to take a step back and talk about 40 years of the Global Gag Rule. What is it? What are we seeing? Why are we talking about it now, but beyond it being the anniversary? And how can we make sure to end this policy once and for all? And y'all, I could not think of two better people to come and have that conversation than Beirne Roose-Snyder and Bergen Cooper with the Preclusion Project. So with that, let's go to my interview with Beirne and Bergen. Hi, Beirne and Bergen. Thank you so much for being here.
Hi, Jenny.
Hi, so happy to be here with you.
I'm so excited. Like, I could not think of two better people to talk about. I guess, Mark. Celebrate feels all sorts of wrong. Mark, the 40th anniversary of the Global Gag Rule.
Yeah, it's sad that is what we're known for, but happy to be here to talk to you about it and putting an end to it.
Okay, before we get started, let's do quick introductions. Beirne, do you want to go first?
Sure. I'm so happy to be here again with you, Jenny. My name is Beirne Roose-Snyder. I use she, her pronouns, and I'm the senior director at the Preclusion Project, an independent project that works to make lawyers and organizations and donors and activists more resilient to U.S. anti-gender policies, including and especially the Global Gag Rule.
Bergen.
Hi, my name is Bergen Cooper. My pronouns are she and her. I'm the Senior Research Advisor with the Preclusion Project. I'm also the Chief Operating Officer with the Torchlight Collective, a multidisciplinary international human rights consulting firm.
Okay, so I'm so excited you're here, even if it's to talk about not great things.
Yep. We're happy to be here with you.
Yeah. It's been a while since we've talked Global Gag Rule on the podcast, so I figure it's been 40 years. Maybe we should talk about what it is and a little bit of the history before we talk about anything else.
I'd be happy to. I'll sort of start off with the most basic structure of the Global Gag Rule. It is a presidential action that then becomes a contract provision that restricts different types of U.S. global health assistance. So this is a announcement by a president that then gets distilled down into impacting our health programs all around the world. And what it particularly does is it says that if you receive U.S. money, you cannot provide or promote or do public education about abortion as a method of family planning. And it first went into effect in 1984, and people know it as a policy that comes back and forth. It's oftentimes talked about as being a switch that gets turned on and off with Republican administrations and Democratic administrations over the last 40 years. It doesn't always get a lot of focus in the United States as a voting issue because the people harmed by the policy, both those on a programmatic level, but also those on a level of the health services they're able to get, they're not U.S. voters. And so it oftentimes sort of doesn't get the attention it needs, but it's a way that the U.S. has been exporting our anti-abortion policies and restrictions to destabilize and make less efficient global health money around the world. And I'll go into a little bit more detail about the history of it since we are talking about the 40 years, because it is a really sort of extraordinary thing that happened in 1984 and then has these ripple effects as it's become part of American partisanship. And it was actually began in August of 1984 as a moment at the United Nations International Conference on Population. This was the second, I think, UN ICP. It was before it was PD, I think. And the first one in 1974, or the previous one in 1974, had been in Bucharest. And this one was in Mexico City in 1984. And this is why it's oftentimes called the Mexico City policy, is because it arose at the Conference on Population in Mexico City in 1984. I think it's really valuable for listeners to sort of understand that, because we've also talked about 1994 and that Conference on Population and Development in Cairo as being this massive watershed moment for sexual and reproductive health and rights, and also for reproductive justice. But before that watershed in Cairo, 10 years before, we have the Reagan administration using this Conference on Population as another political moment for them on the Cold War, population dynamics, and economics. So where this Mexico City policy came from, it's not about health or rights. It's actually coming from a place of sort of Cold War fears about population dynamics in, and I'm quoting here, the third world, and how U.S. wanted to use their economic power in response to it. So even the language as a method of family planning, it only really pops up in the U.S. sense based on Title X, and that was language inserted by the Catholic bishops. And then it's also used in the Cold War context as an accusation of how the USSR used abortion, quote, as a method of family planning. So all of the policy is really rooted in this really stressed economic and population bulge politics, and was not in any way about individual health or rights, about bodily autonomy, about good health care. It wasn't really about maternal mortality or morbidity. And it really was a direct quote from the original policy statement from the Reagan administration, was that, by helping developing countries slow their population growth through support for effective voluntary family planning programs in conjunction with sound economic policies, U.S. population assistance contributes to stronger saving and investment rates, speeds the development of effective markets and related employment opportunities, reduces the potential resource requirements of programs to improve the health and education of the people, and hastens the achievement of every country's graduation from the need for external assistance. So even from the very beginning, this was viewed as like a political and economic tool, not ever about outcomes or health and rights. So that's the sort of very Reagan history of it. And we see it in place as applied, this restriction to U.S. family planning during the Reagan administration and then George H.W. Bush's administration. So we see it in place from 1984 to 1993. Then Clinton put out his own presidential memorandum that revoked the 1984 one. There was a weird budget year in there that is probably worth its own podcast on the politics of it, where Clinton needed to attach it to a funding bill the last year of his administration. And then it came back into place for George W. Bush. So from January 2001 to January of 2009, it was back in place, still applying to that about $500 million in U.S. international family planning assistance a year. Then it was removed, again through a presidential memorandum by President Obama in January of 2009 through January 2017. And then in January 2017, not only did the Trump-Pence administration reintroduce it, but they also expanded it to all of global health assistance. So now we have this abortion-related speech, association, service provision restriction, not just applying to U.S. family planning assistance, but also applying to all of global health assistance. That included PEPFAR, maternal child health money. And what we really saw was, almost 15 times the amount of money was impacted in those 4 years than it had been in previous administrations. So in January of 2021, we saw the Biden administration again remove the policy. It's not in place right now. And for the first time since Reagan, really, put the removal of the policy into some kind of context. And that context was around the rights, the right to health, the right to information, the right to bodily autonomy for women and girls around the world. And that was the first time that was put in really a rights-based context of why we need to get rid of the policy. So that's where we are right now, is the policy has been removed by the Biden administration, but it continues to be a political switch that can go back and forth depending on the administration.
I have to say, I've been working on this for like 15 years, but the thing I love about Beirne is that I still learned new things listening to her talk. That's always like, I want to be Beirne and know all the things when I grow up.
It's a good thing to want to be when you grow up. I support this. I second it.
Right. Okay, so that was like such a great history. And I think one other thing I want to flag, just for people who aren't as familiar, Beirne mentioned PEPFAR, and that's global AIDS funding, just if people are not as familiar with that.
Yes, so that's our global AIDS funding. And I should have also taken a moment to really say, Bergen and I, Jenny, we're all going to be calling it the Global Gag Rule. And we're going to be calling it the Global Gag Rule throughout time and space from 1984 until now. But the administrations originally called it the Mexico City policy, which is not fair to Mexico City. They have very progressive abortion laws. And then in the Trump administration, when they expanded it, they have renamed it Protecting Life and Global Health Assistance. Advocates, activists continue to call it the Global Gag Rule, even as it's expanded and even as it's impacted more people and more money. It continues to, at its core, be a restriction on how you can talk, who can speak, what type of research you can do, what type of services you can provide, and it continues to gag both medical providers and organizations.
Okay. I think the next big bucket, now that we know what it is, impacts. Like, what are the impacts that we have seen from this policy being in place?
Yeah, it's a great question, Jenny, and the impacts are long and far-reaching. So by the time this has aired, we have released a new data brief that covers 40 years of impact of the Global Gag Rule. And, you know, as Beirne framed, we think of this originally as an economic policy, and maybe somebody frames it as an abortion policy, and some of us frame it as a free speech policy. And when push comes to shove, when you're looking at impacts, what you'll see is impacts across all areas of people and of work. So which is extremely challenging as we think about how to organize and talk about the far-reaching impact. And you will see on the data brief how we chose to break down the impacts. And excuse me as I go into a long list here, because the impacts of the Global Gag Rule are really, it is a long list. So we have documented impact of the policy on international human rights principles, sexual and reproductive health and rights services and outcomes, wrongful implementation of the policy, on advocacy, on partnerships, on coalition spaces, on national sovereignty, on different populations like LGBTQI populations, people living in rural areas, people living with disabilities, sex workers, on healthcare providers, of course, on abortion, on contraception, on mortality, on gender-based violence, on HIV/AIDS and other sexually transmitted infections. I'm going to keep going. The list goes on maternal and child health, on humanitarian funding, on humanitarian programs, on nutrition, on water and sanitation and hygiene, on research, and of course on COVID-19. And as Beirne mentioned, when the policy was revoked under President Biden, we still continued to see impacts. And so we have data on the impacts of the policy post-revocation. Jenny, you know, I appreciate the coverage that rePROs Fight Back has dedicated to the Global Gag Rule, and I'm glad that you and I have had opportunities to talk about the policy in the past. But since we've talked about it, new data has been published. Beirne and I were thinking about, you know, does there need to be another data brief? Does there need to be another fact sheet? And the truth is we've had at least 15 new articles published recently on the impact of the data. And some of this I'd like to flag for you today, because oftentimes when the policy comes into place, we have conversations with reporters and they want the numbers. They want to say how many people died because of the policy. And for a while, that wasn't how the research was set up. That data takes a lot longer to gather. We had qualitative research much earlier into implementation of the policy under the Trump administration, but some of that quantitative data does take longer, and it has been published now. So in terms of mortality, we have data that shows that for countries with an above median reliance on U.S. family planning, so they're relying on more U.S. family planning, the switch from a Democrat to a Republican presidency is associated with an 8% increase in maternal mortality. So to put an 8% increase in perspective, that's eroding a fifth of the average worldwide decline in maternal mortality that had been achieved since 1990. Using data from 134 countries, and this is from 1990 to 2015, researchers found that the global gag rule is associated with a higher child mortality rates. Again, the strongest impact shown in countries that have a heavier reliance on U.S. funding for family planning. We did have stories of specific death from the policy. 2 young women in Kenya died from unsafe self-induced abortion because an organization, in order to keep providing HIV services under the global gag rule, under Trump's global gag rule, could not offer information or referrals for safe abortion. And I mentioned that this was an organization that had to keep providing funding for HIV services. We continue to have data around the impact of this policy on HIV and AIDS. Again, research that, again, was using data from 134 countries between 1990 and 2015. They found that the global gag rule is associated with a higher HIV incidence. Again, strongest impact in countries that have the heavier reliance on U.S. family planning programs. In terms of maternal and child health, researchers found that after the global gag rule was revoked under the Obama administration, countries with high exposure to the policy during George W. Bush's administration had significant improvements in infant, neonatal, under 5 mortality. They had lower fertility rates and increased birth rates. So what we're seeing in the data is when the policy is in place, it is hurting mortality, it is hurting child health. And then when it is revoked, we can actually see the improvements coming along the lines of health. And of course, abortion, I understand that people want to know the impact on abortion. And if the policy was put in place to reduce abortion, it is a gross failure. We have one of the more popular citations is 26 countries in sub-Saharan Africa indicate that they saw approximately 40% increase in likelihood of abortion under President George W. Bush compared to when it was removed by President Clinton and Obama. So we're seeing increases in abortion when the policy is in place. We see this in sub-Saharan Africa. We see this in Latin America as well. And there's also one thing that in terms of when I was talking about the impacts that I didn't mention, which is the chilling effect. We see that organizations over-implement or self-censor their speech related to sexual and reproductive health and rights, and sometimes unnecessarily end or curtail programs, including service provision or joining a coalition meeting or joining an advocacy space in fear of having their funding revoked. I will pause there. I will tell you that this data sheet is 20 pages of bullet points of the impact. So to spare your audience, I won't go through every single one, but happy to jump into more details. And I know Beirne spends so much of her time talking to folks around the world about the impact. So Beirne, if there's other points that you want to be sure to add in, please jump in if there's other points that you want me to refer to.
I think you are so precise and you're so correct about all of this and the big top lines, both the ones that sort of make some intuitive sense and some of the ones that are take a little bit more unpacking. I think the top line, though, that we just have to sort of put front and center again and again is that there's no data, there is no evidence suggesting health benefits or health positive outcomes or efficacy of foreign assistance funds. There's no data anywhere that says anything good about 40 years of the global gag rule. This is not a piece where we say our bit and then someone says, well, we've got all our data on the other side. There isn't data on the other side. There is a belief in the fact that there are bad people, bad organizations that provide and promote abortion, that work on abortion somewhere in the world, and that they should be isolated and cut off. That is the whole belief system that goes into the global gag rule. There's no assertion that anything good comes for health services, for individuals, for any kind of data-driven outcome.
One of the things I often think about is not just how harmful this policy is when it's in effect, but like the long tail of like seeing the harm even after it's gone. But I guess that kind of leads me into my next question of thinking about, so it's not in effect. It's not been in effect since Biden went into office. Other than it being the 40th anniversary, like why are we talking about it right now?
Well, Jenny, I joined you back in, I think, January or February to talk about Project 2025. And that is a big reason why we're talking about it now. We know that when the next conservative president comes into power, the stated ambition is not just to bring it back to the Trump era, which was, as Bergen just described, catastrophic to health gains in maternal mortality, in child mortality, in HIV, new HIV infections. Not just bring it back to that Trump era, but to use this space in foreign policy to push even further. And so right now, and we see this both in a Senate bill, we see it in negotiations and pushes happening in the House of Representatives, and we see it stated very plainly in Project 2025. The intention for the next step is to expand the Global Gag Rule directly to US-based organizations, to government funds, to multilateral organizations, and to all of US foreign assistance. So that includes humanitarian aid, democracy, rights and labor, education, just development assistance broadly, and humanitarian assistance broadly. So we are at a precipice where we know what the last 40 years have brought in terms of instability, pulling back global health progress, bad outcomes, incredible disorienting chaos at a clinic level and an organizational and country level. And we know that what they intend to do is now put that onto steroids for the next conservative administration. So we are unfortunately we are on the precipice of that switch, and which way it's going to turn, if it's going to turn, is the open question this fall.
Yeah, the thought of it expanding so much further is really kind of scary. Like, one of the things we've been focusing on at rePROs is sexual and reproductive health in humanitarian settings, and the thought of it attaching to that is scary for the impacts it could have on people around the world, on all of those ways that it would get added on. But that's just one that has been sitting with me for a little bit.
Yeah, absolutely. And I mean, we have documented the government trying to attach it to humanitarian funding in the past. And we have seen humanitarian organizations that were gagged over implemented the GGR to avoid being non-compliant, the chilling effect that we talked about before. So we certainly have seen impact in the humanitarian space, even when the policy does not attach to humanitarian funding. So yes, the impact would be far greater and more devastating.
Okay, let's turn to like a little bit of like hopeful instead. What can we do to make sure that the GGR doesn't come back at all? Like, how do we finally end this?
The technical answer is that Congress needs to pass a bill that would keep presidents from being able to put it back in place, to sort of take the power of this decision out of the hands of the president. In this Congress, that bill is called the Global HER Act. I think it will probably be a slightly different bill in coming years. It's something that could easily get done. Congress could pass it, a president could sign it, and we could be done with this flip-flopping that has created such incredible instability around sexual and reproductive health and rights, and really undermined the local and national goals of countries all around the world. So Congress has that ability to act if they want to. I would say for listeners, it's not just a question about getting your member of Congress to prioritize or sign the bill. There's a lot of priorities right now. And many of your listeners live in districts in which they know the members of Congress are not going to ever flip a vote on something that's couched as abortion related. I still think it's worth having meetings in which, ideally in district, in which you are talking about the incredible harm of this policy. Because it's foreign policy, members of Congress are almost never confronted with meetings about it, particularly members who are going to sign off on a letter, go, oh yeah, more abortion restrictions. Yeah, I should totally do that. And are never, ever confronted with the data on the policy increasing abortion, on it increasing maternal death and child mortality, on it increasing HIV and reducing efficiency. And so even if you know that it's going to be a meeting in which they're not going to flip their vote, I think for where the people can, going in and talking about the data, talking about the harm and the fact that you don't think they should be harming people, especially women and girls around the world, in their name, that's a great meeting to take with your member of Congress, no matter what. Make them feel bad. Make them feel that there are real human repercussions to their incredibly lazy culture wars talking points.
Okay. I'm trying to think if there is anything else. I think we hit all the things, unless Bergen has anything she would like to see the listeners do.
I would like to see them read the entire data sheet, and I want to hear from them. My email's on there. If there is data that you have that I don't, send it my way. If you have questions, I want to talk to you about it. If you want to think about how you're messaging this, Beirne and I both want to talk to you about this. I'll be your data friend. Reach out.
And we will definitely include a link to this amazing new brief in the show notes, so you will have easy access to it.
Thank you. Fabulous.
Beirne, Bergen, as always, it was delightful to talk to you about the Global Gag Rule.
Thank you so much, Jenny. Good to see you.
Thank you, Jenny. Hopefully this is the last time we will talk to you about it, because 40 years is enough. It started out as, an absolute Cold War, us versus them policy. It's 40 years later. It's continuing as a U.S. culture war, us versus them policy. It doesn't need to be us versus them. We could have data-driven foreign assistance. We could be done with all of this, and we could do a little bit to make the world more stable and more responsive to the needs of people and their health services.
Yes, a policy that is almost as old as me. That is terrible. It's time it should go.
It's time.
Okay, y'all, I had so much fun talking to Beirne and Bergen. And like I said, I've been working on this issue for 15 years. And still, when I have and talk to Beirne and Bergen, I always learn new things, from both of them. Bergen has so much, is so on top of the research, and I always learn so much. And Beirne has all of this policy insight and knows all of these details that I just am always so continually impressed with the two of them. And so I was so excited to get to talk to them about all things GGR. So I hope you enjoyed our conversation. And with that, I will see y'all next week. If you have any questions, comments, or topics you would like us to cover, always feel free to shoot me an email. You can reach me at Jenny, Jennie, at reprosfightback.com, or you can find us on social media. We're at Repros Fight Back on Facebook and Twitter, or Repros FB on Instagram. If you love our podcast and want to make sure more people find it, take the time to rate and review us on your favorite podcast platform. Or if you want to make sure to support the podcast, you can also donate on our website at reprosfightback.com. Thanks all.